devastating report last summer by a clinical advisory panel led by Professor Nick Slevin at the instigation of NHS England into the future of Mount Vernon Cancer Centre said, and I quote, "There was increasing concern as to whether high-quality, safe and sustainable cancer services could continue to be delivered and that there was an urgent need to address this concern. If media reports are to be believed, this is the first time in the NHS's 71-year history that a major hospital specialising in such an important disease has been deemed to pose a risk to patients and been declared unfit for purpose." They went on to note, the panel, that much of the existing buildings and other estate used by the cancer centre was dilapidated and not fit for purpose, and that there was a need for considerable investment in buildings, equipment replacement, IT connectivity, as well as staff. Now, Mount Vernon is a nationally recognised specialist cancer service, up there alongside the likes of the Royal Marsden or the Christie in Manchester. So for it to be so dilapidated and so short-staffed, and at a time when cancer diagnoses are rising, is deeply worrying. The panel went on to recommend a change in the trust managing the service, and crucially that some of the service, it would appear in practice to be most, was relocated into a hospital with comprehensive acute services. The report went on to insist that significant capital investment should be made available to address the need for a full or even a partial move of the service. It argued that the buildings and wider estate used for cancer services should then be managed by the NHS Trust actually providing the services to strengthen operational control. Professor Slevin made clear that he and his colleagues were greatly impressed by the determination of staff to continue to provide the best quality care they could under the difficult circumstances within which they were working. He also noted the consistently positive feedback from patients about the care they receive at Mount Vernon, a point many of my constituents who've used the service have underlined to me. Mount Vernon is a part of the NHS that I've known for a very long time, having used its minor injury centre a number of times and having campaigned to save its then accident and emergency department in the mid-1990s. Over 1,000 residents in Harrow use the service each year, and I'm yet to hear a negative view of the professionals there. But I and my constituents are keen to ensure that the service is maintained to a high standard and that it stays on the Mount Vernon site, or in the next best scenario, local to Mount Vernon, and critically, that there is a sustained period of investment in staff, buildings and equipment there. I now believe, I think, that despite University College London hospitals coming on board, that there is no plan to shift Mount Vernon's cancer service to central London. It would be good, though, to hear that confirmed by the Minister. Professor Slevin's report went on to set out a short-term action plan involving the transfer of the leadership, governance and management of Mount Vernon's cancer services to an experienced tertiary or leading cancer service provider from London. That apparently is now sorted. Secondly, the appointment of additional staff. And thirdly, urgent backlog maintenance work to existing clinical facilities. So I therefore welcome clarity from the Minister on the progress made in implementing that short-term action plan. In particular, will he publish the list of urgent backlog maintenance work, which Professor Slevin and the rest of the clinical advisory panel noted was essential, and crucially, what progress has been made in tackling that work? I ask as a written parliamentary question I tabled, which the Minister answered on the 11th of February, suggested that just removing asbestos from Mount Vernon would alone cost some £12 million. While a written parliamentary question published on the 21st of October last year, again which I tabled, suggested, and I quote, "Challenges remain around securing capital funding for backlog maintenance and long-term solutions for the service." On staffing, will the Minister set out how many additional staff needed to be appointed to the acute oncology service back in July last year when the report was published, and the progress that has been made in tackling these staffing shortages? I understand from the written parliamentary question I tabled, answered on the 21st of October, that a business case for additional staff in this area was developed and approved. Specifically, would the Minister release this business case and then confirm how many of the staff positions approved for recruitment have been filled? The short-term action plan also noted that robust implementation of policies concerning admission criteria, daily consultant rounds and patient reviews was necessary, which would require additional medical staffing. Again, it would be good to have published how many extra clinicians were needed back from July last year and what progress has been made in tackling those staffing shortages. Again, the written parliamentary question that was answered on the 21st of October last year suggested that a proposal for an enhanced 7-day-a-week consultant model and robust outreach medical acute oncology service provision had been developed. Was it approved? Can the business case be released, Sir Christopher, and the House informed of progress in its implementation? A further written parliamentary question I tabled, which was answered on the 10th of February, did not give confidence that enough action was being taken to tackle the immediate critical vacancies. The Minister, in her answer, then said there was a 25% vacancy rate for nurses at Mount Vernon Cancer Centre and almost 10% vacancy rate for medical staff and almost 30% vacancy rate for clinical support staff and an 8% vacancy gap for scientific, therapeutic and technical staff. Given the seriousness of the findings in Professor Slevin's report, I'm surprised more progress has not been made in reducing these vacancy rates. But it is the long-term future of Mount Vernon Cancer Centre that most exercises my constituents, and no doubt many others in surrounding areas who also depend on the services at Mount Vernon. The impact of the lack of capital investment is obvious to any visitor or patient. The acid test of the commitment of ministers to the future of Mount Vernon's Cancer Centre is around, I think, whether they will invest in the new linear accelerators the service needs. Linear accelerators are fundamental to the delivery of radiotherapy services, but are costly to put in place. Mount Vernon has 7, 6 of which are due to reach the end of their normal operational lives over the next 3 years. Professor Slevin's report last summer noted the age of the linear accelerators, or LINIACs, and again, a written parliamentary question on the 11th of February noted some of the costs of replacing LINIACs, particularly if they were being moved to a new site. A written parliamentary question answered a day earlier noted that 3 of those 7 linear accelerators are due to be replaced this year, with 3 more due in 2022. Are the 3 linear accelerators due for replacement this year going to be replaced? And if not, why not? Professor Slevin's report also noted that the brachytherapy service at Mount Vernon Cancer Centre is nationally recognised, but access to theatres for treatment is, quote, constrained. I wonder what the long-term plan is to sort this issue. Professor Slevin's report also noted the desire of NHS trusts for East and North Herts and the Hertfordshire STP to see Mount Vernon Cancer Centre services re-provided in fit-for-purpose buildings, replacing the oldest facilities. Indeed, so old and decrepit are the buildings that leaking roofs have forced, quote, adjustments in service provision. 9 months on, let me ask the Minister, are there any leaking roofs at Mount Vernon that are still forcing more of the cancer services, the cancer centre services to be moved? There are insufficient rooms for medical staff, for specialist nurses, dietitians and speech and language therapists. Inadequate electronic systems and poor IT connectivity slowing the clinic process. There is no direct real-time connection of the X-ray systems between Mount Vernon Cancer Centre and hospitals in its catchment area, again undermining the effectiveness of clinical management. The report stresses that the impact on poor IT infrastructure should not be underestimated. There are clinical risks as a consequence of duplicate paper records, lack of access to complete scanning images out of hours, and the inability to view a comprehensive patient record. In short, doctors can't access the results of critical CT and MRI scans out of hours. Now, in the short term, according to a written parliamentary question, again answered on the 11th of February, a plan to digitise patient care records at Mount Vernon is expected to be ready for implementation in May this year. So I ask the Minister, has the funding been identified to allow that to happen, or will it have to wait for a full review of the future of Mount Vernon Cancer Centre to be completed? I hope it's the former. Professor Slevin's reports left unresolved the exact long-term future for Mount Vernon. A strategic review of Mount Vernon Cancer Centre to resolve this very question is, I understand, expected to be completed sometime this year, again according to the written parliamentary question answered by ministers on the 11th of February. I ask, who is going to lead the review? What clinical expertise do they have? And how can we be sure that they will see it through to its completion? What is the timeline for that review? Part of Mount Vernon Cancer Centre's problem is that the Mount Vernon site is owned by Hillingdon Hospital's NHS Trust, while East Hert's NHS Trust runs the cancer service. Add in the confusion as to which part of NHS England is responsible for owning the future of Mount Vernon, and it's not hard to see why, despite two concerning CQC reports in the last 5 years, there might have been a lack of top-level NHS focus up until now on Mount Vernon's future. I understand too that a further transfer of responsibility within NHS England for Mount Vernon's future from NHS East of England to NHS London is inevitable when the University College Hospitals London NHS Trust takes over direct responsibility for the cancer centre. Given that, and given the number of ministers in the Department of Health that have answered my questions so far about Mount Vernon, the answers for which I am very grateful, it would be good to know which of the Secretary of State's ministerial team will continue to have immediate and ongoing responsibility for this project. If it is the minister opposite, given his seniority within the Department of Health, then I, and I'm sure my constituents, would welcome that fact. This 117-year-old hospital is not one of the 6 named for rebuilding, or one of the 40 for whom a rebuild or upgrade appears to be on the cards over the next 5 years. Not surprisingly, I've been asked whether the cancer centre at Mount Vernon is set to close. The omens certainly don't look good, but assuming that isn't ministers' intentions, and that central London is not their intention for a move either, that would suggest a local move to Hillingdon Hospital or Watford General, where, as I understand it, upgrades have been announced or are planned, or failing those two options, then either Northwick Park Hospital or one of either Stevenage, Cambridge or Luton are likely. My constituents and others deserve to know Mount Vernon Cancer Centre's problems are being sorted out. To give confidence to that end, transparency to the local community is essential. Given the seriousness of Mount Vernon's situation, regular quarterly updates that are easy to understand and which offer a route to track progress is surely not much to ask for all those who use the cancer centre. To make such updates helpful, they should include consistent answers to 3 fundamental and continuing questions. What extra staff does Mount Vernon need and what's being done to fill the vacancies? Secondly, are the 3 linear accelerators due to be replaced this year going to be replaced? And thirdly, when is a decision going to be made on Mount Vernon's future? Who is going to have a say and how can they be influenced? I hope the Minister will agree to that request for such updates. I look forward to his reply. Lastly,